Welcome to your 2026 AD Transport Express Open Enrollment presentation. Let's review important eligibility information. Full-time employees defined as working at least 30 hours per week are eligible for the benefits program. Eligible dependents include your legal spouse and dependent children. Dependent children may remain on your medical plan until the end of the month in which they turn 26. For new hires, coverage begins on the first day of the month after 60 days of full-time employment. If short-term disability is elected, it begins after 12 months of full-time service. Coverage ends on your last employment day, but medical, dental, and vision benefits can be continued via COBRA. During open enrollment, you can make changes to your benefit elections or dependents. Outside of open enrollment, changes are only allowed after qualifying family status changes and must be reported to Human Resources within 30 days to update your elections. Exceptions for Medicare or Medicaid entitlement allow 60 days for changes. For further details, reference your benefit guide. When completing your medical benefit election, take your time and write neatly, especially your Social Security number. If it's unclear or incorrect, claims may be delayed or denied. Select only one medical plan option. If you wish to decline medical coverage, check the Waive Medical Coverage box. Weekly costs for each plan are shown based on coverage level. Review each option carefully to choose what best fits your needs. Completing the form accurately ensures smooth coverage and prevents avoidable issues. Let's review your medical plan options for 2026 to 2027. When selecting your medical plan, remember that the two Priority Health HMO medical plans are only available to employees who live in Michigan. Priority Health's HMO service area includes Livingston, Macomb, Oakland, St. Clair, Washtenaw, and Wayne counties. If your permanent mailing address is out of state, do not select either of these plans. The Priority Health $1,000 HMO plan offers two provider networks, Tier 1, the Southeast Michigan Narrow Network, and Tier 2, the full HMO network. Tier 1 features lower costs, a $1,000 single or $2,000 family deductible, lower copays for doctor visits, and affordable prescription copays. Tier 2 offers broader access but higher costs, with a $2,000 single or $4,000 family deductible and higher copays. Preventive care is covered at 100% in both tiers, and the out-of-pocket maximum is the same. All members must have a designated PCP and can self-refer to specialists. Out-of-network care is not covered unless it's an emergency. The Priority Health $3,000 HMO plan also uses a two-tier network system. Tier 1 has a $3,000 single or $6,000 family deductible, with copays matching the lower plan. Tier 2 has a $6,000 single or $12,000 family deductible with higher copays for services. Preventive care is covered at 100% in both tiers, and the out-of-pocket maximum is the same. All members must have a designated PCP and can self-refer to specialists. Out-of-network care is not covered unless it's an emergency. This slide compares the Priority Health PPO $2,500 plan and the Priority Health POS HSA $5,000 plan. The PPO plan offers copays for office visits and urgent care with a $2,500 single or $5,000 family deductible. The POS HSA plan is an HSA-compatible high-deductible plan with a $5,000 single or $10,000 family deductible, covering all services after the deductible is met. Preventative care is covered at 100% in both plans. Out-of-network care is covered but at higher costs. Services performed out of state through participating Cigna providers are covered at the in-network benefit level. See your enrollment form for medical rates. A health savings account, or HSA, pairs with the Priority Health POS HSA $5,000 plan, letting you pay for doctor visits, prescriptions, dental, vision, and other qualified healthcare costs. The HSA belongs entirely to you. Money rolls over year to year and stays with you even if you leave the company or retire. The HSA offers 3 tax benefits. Contributions are tax-free, the money grows tax-free, and withdrawals are tax-free for medical expenses. If you enroll in the HSA qualified plan, you pay the full cost for care until you reach your deductible annual IRS limits apply for contributions, with extra for those over age 55. If you are turning 65 soon, you may be eligible for Medicare. Medicare is health insurance for people age 65 or older, and some qualify earlier due to health conditions. You'll need to decide when to enroll, which parts you need, and how Medicare works with your current coverage. These decisions can be confusing, but we have a Medicare specialist who can guide you, help you enroll at the right time, and avoid gaps or penalties. Contact HR if you are turning 65 already eligible for Medicare or have questions. Let's review the dental and vision plans for 2026 to 2027. The Guardian Dental PPO offers two options. The base plan covers only in-network providers and has a $1,000 annual maximum, while the buy-up plan allows in- and out-of-network care with a $1,500 annual maximum. Preventive services are covered at 100% in-network. Basic and major services require a deductible and coinsurance. Orthodontics are not covered. Rates are listed on your enrollment form. No dental cards will be mailed. All eligible employees can enroll in the Guardian VSP Vision Plan, which allows you and your family to see any provider, but maximizes coverage with VSP Choice Network providers. Eye exams are a $10 copay, and lenses are covered at $0 after copays. Frames have an 80% allowance over $150. Contact lenses and medically necessary lenses are available. Frequency limits apply for exams, lenses, and frames. No physical vision cards will be mailed. You can access your Vision ID information online. To participate in AD Transport's wellness program and receive a $25 per month wellness credit starting August 1st, 2027, you must be enrolled in a Priority Health Medical Plan on August 1st, 2026. Complete your annual physical between June 1st, 2026 and June 1st, 2027 and sign the HIPAA Authorization Member Form. Only your name and date of physical will be shared with AD Transport. Physicals do not qualify. It must be a preventive physical by your primary care doctor. Let's review the voluntary benefits available for 2026 to 2027. Guardian Voluntary Life Insurance is available for employees, spouses, and dependent children. Employees can elect coverage in $10,000 increments up to $300,000, with a guaranteed issue of $250,000. Spouses must have employee coverage and can select increments up to $200,000. Guaranteed issue is $25,000 for spouses under 70. Dependent children are eligible for $5,000 or $10,000. AD&D coverage is included. Coverage reduces by 50% at age 70. Plan features include portability, conversion, waiver of premium, and accelerated life benefit. Eligible employees after 1 year of service can participate in voluntary short-term disability insurance through Guardian. Benefits begin after the 7th day due to accident or sickness. The plan pays 60% of your base weekly earnings up to $1,000 per week for a maximum of 13 weeks. If you don't enroll when first eligible, evidence of insurability is required for future enrollment. This benefit is 100% employee paid. Guardian Accident Insurance pays benefits based on the type of accidental injury and treatment, covering incidents that occur off the job. Examples include ER treatment, child sports injuries, burns, concussions, tendon injuries, eye injuries, ruptured discs, and accidental death or dismemberment. Guardian Critical Illness Insurance provides a lump sum benefit for covered conditions like cancer, heart attack, stroke, major organ failure, paralysis, multiple sclerosis, and more. Employees can pick $10,000, $20,000, or $30,000 coverage. Spouses and children are eligible for partial amounts. Guardian Hospital Indemnity Insurance pays cash benefits directly to you during hospital stays. $1,000 is paid per hospital or ICU admission, limited to 1 admission per insured and 3 per covered family each year. $200 is paid per day for hospital or ICU confinement, limited to 15 days per year. Benefits can be used for medical or personal expenses. A pre-existing condition limitation applies. The Guardian Employee Assistance Program provides confidential counseling, expert guidance, and resources for life's challenges. 3 face-to-face or virtual sessions per issue per year are available for concerns like stress, anxiety, depression, grief, and relationship conflicts. Work-life balance support includes childcare, elder care, moving assistance, and government resources. Legal and financial guidance, online will preparation, wellness coaching, and digital tools are also available. Services are accessible 24/7 by phone, online, or via the Guidance Now app. Once your coverage starts, download the Priority Health app and sign in to your medical account. You can see your digital ID card right away. Schedule doctor appointments 1 or 2 weeks after your planned start date to allow time for coverage setup. If you have any questions, reach out to your HR team for assistance. Thank you for reviewing your 2026 to 2027 benefits with AD Transport Express.